Good afternoon and welcome to the Software Engineering Institute's webinar series. My name is Shane McGraw and I'd like to thank you all for attending today's webinar. Our webinar series presentation today is Securing Information in the Healthcare Industry, Network Security, Incident Management, and Insider Threat, presented by speakers Greg Porter and Randy Trezak. Now I'd like to turn the presentation over to Greg. Greg?
Okay, thank you, Shane. Good afternoon, everyone. My name is Greg Porter. As Shane had mentioned, I am a visiting scientist at SEI CERT, and happy that you all could make some time for us this afternoon to talk a bit about healthcare information security. We have a brief agenda here, fairly straightforward. What we're going to accomplish over the next several slides is talk about the current state of healthcare information security. You cannot really talk about the current state without discussing some of the recently passed legislation as well as some legacy legislation that's been in place for a number of years now regarding the protection of health information. We'll then transition and discuss the threat landscape. In many ways, it's not all that different from the information security threat landscape that's been discussed and that I'm sure many of you listening are familiar with, but there are some special areas and some anecdotal information we look forward to sharing with you. Then we'll talk about briefly some defensive strategies in terms of some governance frameworks and some controls and ideas that you might want to consider implementing to protect health information, and we'll wrap up with a slide on a conclusion, just a few bullets there. This presentation is based on technical and non-technical healthcare security assessment observations made by me personally, other security professionals that I've worked with through the past several years. I've personally been working in healthcare specific related security engagements since 2002 or so, really with respect to the Health Insurance Portability and Accountability Act, and more recently the Health Information Technology for Economic and Clinical Health Act, for those of you taking notes, passed as part of the Stimulus Act, the American Recovery and Reinvestment Act of 2009. The bottom line is that we're really just trying to simply provide an overview as well as provide you, the audience, with a feel for the healthcare profession as it relates to security more generally. Recent developments that are having a material and direct impact on the healthcare industry. And the takeaway is really that regardless of whether we're talking about healthcare specifically, these observations are highly transferable across industries. So for some of you that may be working for and or advising healthcare clients, hopefully there's some useful information in here. We believe there is, but also within other verticals as well, manufacturing, utilities, and so forth. So let's talk about the current state and where are we today? Well, it's hard to believe 14 years after the passage of the Health Insurance Portability and Accountability Act of 1996. That's right, 14 years ago since the Clinton administration passed HIPAA into law. And what we want to be mindful of as security professionals, it's been well over 5 years since covered entities, so things like hospitals, insurance providers, clinicians' offices, for example, and healthcare clearinghouses, since they've had to be compliant with the HIPAA security rule. The High-Tech Act has introduced some new components that really have a direct impact not only on covered entities, but also the covered entity's business associate. And what I mean by that is that the business associates are now required by law to adhere to the HIPAA security rule as well as the HIPAA privacy regulations. Today also marks an anniversary. When you're in this industry long enough, it's probably not all that exciting news, but September 23rd of 2009 marked the introduction of the breach notification requirements under high-tech, the interim final rule. Now that was to be finalized this past summer with some harm specifications and some other updates to the breach notification law, but that's been put on hold, so the interim final rule is still in effect today. You combine that with July 27th of this year, meaningful use and electronic health records. So in other words, defining what is a meaningful user of an electronic health record, what are some of the core objectives for EHRs as well as the menu set objectives. So those have been defined clearly by Health and Human Services, and organizations that are looking to implement EHRs are going to want to certainly pay attention to those details. So we have a broad swath of legislation, yet we continue to see healthcare organizations struggle in terms of their protection of electronic protected health information. On slide 9, we talked briefly about the regulatory landscape, HIPAA security and privacy, but there's a myriad of other compliance obligations that may come into the picture depending on how you're managing not only medical information, but things like credit card data, for example. So if you're taking